Say goodbye to pelvic floor pain and fix it for good. If you've been suffering with pelvic floor pain or pain down there that you're not sure exactly where it's coming from, it's way more common than you think. I want to tell you, you are definitely not alone. Although this is something that many women do not like to talk about, it is still something that affects many, many women. It's just something that we don't really talk about. In fact, you may have talked to your doctor about it, and they've said that it's common, especially if it's cyclical and it occurs with your cycle, or if it only occurs with certain activities, such as being intimate. They may have even told you that you just need to figure out how to get through it. And if they have, I want to apologize to you right now, because I guarantee you there is a way to fix it. We're going to discuss the methods today, and you shouldn't have to struggle with this for the rest of your life. Pelvic floor pain is definitely a taboo subject. A lot of women will talk about the fact that they pee when they laugh or cough or sneeze, and that's not really a big deal, especially if you're sitting around having a tasty beverage together. People can laugh about that, but start talking about any kind of pain at any time, especially with intimacy, and all of a sudden, no, we are off limits. We are not going to be talking about that, which is why today we're going to be talking about that. Let's start off by talking about the most common reasons why women have pelvic floor pain. The most common reason is childbirth. A lot of times after delivery, women will have pain, and although it can be normal in the first week or two as your body's recovering, if it goes on for longer than that, that's when it starts to become something that we want to deal with, especially if you continue to have pain after 6 weeks. Usually when it comes to childbirth, for your pelvic floor to heal, we say that should take about 4 to 6 weeks. However, for the rest of your body to heal, all the organs to go back in place, the skin to tighten back up, the abdominals to be working at their previous level, we ask women to give themselves the length of the pregnancy. So that's 10 months. So if you're still dealing with some of those issues, that might be still within the normal range. If your abs aren't as strong as they were and you're 6 months out, then that would be considered normal. However, if you're beyond 6 weeks and you're still having pelvic floor pain, that has gone outside of the normal range. Another common cause of pelvic floor pain is aging. So our pelvic floor does change as we age, and it becomes more fatty and less muscular and robust as we age. However, what we're finding out with the research is that a lot of this is because we don't continue to work on our pelvic floor as we age. So the research is very clear on this fact. If you don't use it, you will lose it, and that includes pelvic floor musculature. So if you become more sedentary as you age, you're not doing as much exercise or the activities that you used to do, this decreases the load on the pelvic floor, which can cause the muscles to get more of that fatty infiltrate and not be as strong as they were before. However, just because you're aging doesn't mean that's normal. There are still things that you can do, including specific exercises, to help your pelvic floor. A huge cause of pelvic floor pain is also a pelvic organ prolapse. So this is when one of the pelvic organs, most commonly it's the uterus or the bladder, actually prolapse into that vaginal canal. A lot of women will experience this not just as pain, but as a bulging that they feel when they're washing themselves in the shower or in the bath. So it's very concerning, and you start to have pain and you feel that bulging because you start wondering what is going on. And I totally understand that is a very concerning symptom when it initially starts. You definitely do want to seek help from a specialist, and especially if you're having a prolapse, you want to find not only a pelvic floor specialist, but someone who can help with organ mobility. You see, the organs are slung in place with these fascial slings throughout our abdominal cavity, which means they can kind of move a little bit, not a ton, but a little bit. And if they've gotten too tight in one area or another area has gotten too loose, those fascial slings are not holding those organs in place, which can cause a prolapse, which can cause that pain as well as that bulging in your vagina. And then you notice that when you're in the shower. It does seem to happen overnight, but I can assure you that this is a process that your body's probably been dealing with for a while. So chances are good that it's going to take a while to unwind all of this and figure out the true cause of your prolapse. And the one thing that we don't like to talk about in regards to pelvic floor pain is that it can be caused by previous trauma or abuse. And many women, once they come into my clinic and start to feel more comfortable with me, will share this truth with me. And this is something that is equally important to deal with. It can be very difficult to be intimate later in life if you suffered from trauma or abuse, especially when you were young. So it is very important to get help, not only from a pelvic floor specialist who can help you with the physical aspects, but also working with someone specializing with mental health to help you process through that. I did have a patient who was suffering with this problem who came to see me, who had actually already been seeing a counselor for a variety of other issues. And once we dove into this and found this truth out, she started working with her counselor with the mental aspect of the abuse, as well as me with the physical aspect. And it was fantastic because although her counselor's not allowed to talk to me because that would be a HIPAA violation, the patient would share information from one to the other. And it became a really beneficial alliance where she felt really supported by both of us. And we felt like we could support each other better with what her therapy was on both ends of the spectrum. Now, you may say, I don't think any of those are the causes of my pelvic pain, and there definitely can be many, many more. Everybody is different, and so your pelvic pain may have started in a different way. You may have had a fall. You may have recently increased your training program, and that's causing some pelvic pain. There are a lot of other things that can be going on. Those are the four most common causes, but if you're not resonating with any of those as the causes, it's really important to find someone who can listen to your whole story, because we want to figure out what started this for you, and that helps determine your path towards healing. All right, so now we know what can cause pelvic floor pain. What can we do about it? All right, these really simple tips I guarantee you can do right now at home from the comfort of your own home, and they will start help working on your pelvic floor. Now, some of them are going to seem a little bit unusual, and I'll explain them along the way, and I'll include links to some other videos that will be helpful for you during this season. First off, I need you to work on some deep breathing. If you've been on this channel for a while, you know that we talk about breathing a lot, but particularly in regards to the pelvic floor. The reason why is the diaphragm, which is the big breathing muscle that sits at the base of the ribs, works directly in opposition with the pelvic floor. So if you think about it, like if you need to poop, right, you bear down, but the pelvic floor's got to relax, right, because it's got to let everything come out. So if your diaphragm gets tight, the pelvic floor technically should get loose, but obviously the pelvic floor knows it can't get loose because then things are going to fall out, and that's not going to go well. So what happens is your pelvic floor tightens up in accordance with the diaphragm tightening up, which makes everything way more difficult and can even cause pain. So the first thing I want you to do is go check out this video over here to make sure that you are doing your deep breathing correctly, and I want you to work on it regularly throughout the day. It's important to keep that diaphragm working correctly to decrease the stress to the pelvic floor. The next thing we want to do is some exercises for that pelvic floor. And no, I am not talking about Kegel exercises. I do not like Kegel exercises for pelvic floor, but definitely if you have pain, because usually when you're trying to do the Kegel exercises, it actually increases your pain. Now here's the reason why. When your muscles have pain, they tighten up. They're dumb, that's all they can do. Muscles are dumb, they tighten up when they sense pain because that's their only defense mechanism. So if you have a tight pelvic floor already because you're in pain and then you try to do something like a Kegel exercise, it's only going to increase your pain. I'm going to link a video here that I recommend women do because it helps to decrease the tone in the pelvic floor as well as strengthening the pelvic floor. So this leads to a more properly balanced pelvic floor as opposed to Kegel exercises, which tend to tighten it up. The next thing I need you to work on is some lifestyle changes. And the first thing is to decrease your sitting time. When you're sitting, especially if you don't tend to sit in the best posture, it can cause increased stress to the pelvic floor. Now, how much sitting is too much sitting? I want you to make sure you get up at least once every hour. I usually recommend walking around. If you're at home, just walking around the house is fine, and drinking some water. The great thing about this is if you drink some water, in a little bit you're gonna have to get up again to go to the bathroom. So it gives you another reason to get up in about a half hour probably at this point. So make sure when you're sitting that you're not sitting for longer than an hour. Also, make sure when you're sitting that you have equal weight through both cheeks and equal weight through both feet. We don't want to be sitting cross-legged, and I know that this is such a hard habit to break, especially if you were taught to cross your legs like a lady when you were younger, but we need to make sure that we have equal weight through our cheeks and equal weight through our feet, because if we don't have equal weight through our cheeks, then we don't have equal weight bearing through the pelvic floor musculature, which can lead one part of the musculature to get tight and one part of the musculature to get weak. We don't want to have an unbalanced pelvic floor. So make sure equal weight through your cheeks, and when you're standing, equal weight through your feet. Now the next one sounds a little crazy, but let me assure you it can be very, very helpful, especially if you're having a lot of pain right now, and that's to do some self-massage. Now a lot of women are like, there's no way I'm going to try to figure out how to massage my pelvic floor, and that's fine. You don't have to. What I want you to do is find some muscles around your hip that feel tight and do some self-massage for those. That can be your low back muscles, that can be your glutes, that can be the side of your hips. And another muscle that commonly gets overlooked is the adductors. Those are the muscles that are on the inside of your thigh. And so if you're wondering where they are, just reach over to the inside of your thigh and put your hand, kind of cup it around on the inside. I guarantee you've got some adductor in there. And then what you can do is just kind of feel around and see if you feel any knots. If you find any knots, work on massaging them out in a circular motion to help decrease the knot, and that will help to decrease the tone in the adductors. Now for women, because we have those wider hips, those adductors do tend to get tight very, very quickly, and many women are very surprised at how tight those muscles are. Now, if you have a massage gun, that can be really helpful, particularly on those adductors, because it can be a little hard to get into them. Or if you've ever used the stick, that little rolly stick, that can be really helpful for those adductors too. And my last recommendation is to make sure that you seek help from a specialist who understands the pelvic floor, organs, hips, and orthopedic structures, so they can figure out exactly what it was that helped to start your pelvic floor pain and therefore determine a plan for you to get better. So how do I know that this works? Because I have helped literally hundreds of women recover from pelvic floor pain that occurred either after childbirth, due to previous trauma, or due to normal aging process. And I had one woman in particular who had had an episiotomy 20 years before that, and she had not had any problems for 20 years that she really noticed. Now, as we got into the history, she was like, yeah, I mean, I definitely pee when I laugh, cough, or sneeze. I have to wear a pad when I go to the trampoline park. I had to stop running because I have hip pain. And yes, I have a lot of neck tension because I don't use my diaphragm to breathe properly. And she also had some constipation issues that were getting worse as she aged. And if you watched any of the videos, you know that all of those can be signs of pelvic floor dysfunction. And so working through the pelvic floor, we were able to clear up the hips, we were able to clear up the constipation, we got her breathing better, and we were also able to relieve the effects of the episiotomy scar on her pelvic floor. So she was able to get back to doing all the activities that she wanted to do, including running, jumping, and laughing, without having to wear a pad on a regular basis. All right, ladies, I definitely hope that that has given you some good ideas and some new insights into your pelvic floor. If you have more questions after watching this video, I'm going to encourage you to download the webinar that I did regarding pelvic floor health and what you can do. It's going to dive way deeper into this topic, give you way more background, as well as some new ideas to help you decrease your pelvic floor pain.